Hi, my name is Lori Menold. I'm a registered nurse, certified diabetes educator here at Sabetha Community Hospital. I just wanted to pop on and just provide you guys, those of you living with diabetes or taking care of someone with diabetes, just a reminder of sick day preparedness that can be used anytime, but especially during the season of COVID. So we've been really fortunate thus far in our community, but it's always good to make sure you have supplies on hand and be prepared ahead of time before you were to get sick. So I will kind of go through that handout here in just a bit, but I do want to just emphasize, if you do get sick, even just early on in your illness, to touch base with your provider. And to review blood sugar, symptoms, and your diabetes medication. Because during this season, there may be medications that they, specifically for diabetes, they may want you to hold. But every situation is different, so make sure you touch base with your provider. Also, a reminder, if your blood sugars are not to target and you have adjusted your nutrition and exercise regimen to the best of your ability, and especially if it's been a while since you've touched base with an educator or provider, to touch base and reach out and make an appointment, and this can be done over telehealth as well, because we do know hyperglycemia or elevated blood sugars is just a better environment for bacterial and viral growth. So we want to be as proactive as we can to stay healthy. Okay, with that, I'm going to just fly through this handout really quickly, but we'll also provide a way that you can access it to view at your own time, or if you so desire to print it. So like I mentioned at the top of the video, there may be exceptions. Your physician or provider may want you to hold certain diabetes medication depending on your situation, but generally you're going to want to keep taking your diabetes medications, because with the stress hormones, blood sugars do rise. So you want to check your blood sugar more frequently so you know what's going on, and keep a log so you know where you are when you speak with your provider. For some of you, may need to check ketones if you have been instructed to do so by your physician or provider. If you have questions about that specifically, just let me know. Generally, you're going to want to try to keep eating if you can. If you cannot, there's instructions on just trying to get 15 grams of carbohydrate in every 1 to 2 hours. That kind of leads into having a sick day kit available, including sugary and non-sugary fluids, especially having Gatorade in your home, so you can have that electrolyte replacement, especially if you can't get in your normal caloric intake. There's also instructions on when to call the physician. If those blood sugars stay over 300, especially for 24 hours, you're going to want to touch base with them. Diarrhea, vomiting, specifics, weak stomach pain, and other reasons that you and your provider have discussed. Also, a really good review of diabetes and COVID, how to prevent transmission symptoms, and when to seek emergency medical attention. And just a reminder to call prior to coming to the clinic or to the hospital. Here is a link to the handout, or also you can go to the Sabetha Community Hospital website, go under Sabetha Hospital, Diabetes Education, and we should have a link to this handout as well. And lastly, just want to thank Diabetes Education Services for access to this handout and the ability to share it with all of you.